Okay. All right. So like the introduction said, my name's Nate or Nathaniel Balch. I work for San Diego Project Heartbeat, as well as Falk San Diego, which is the ambulance 911 provider for the city. And that's all liaison through the San Diego Fire Department. So I'm happy to be here with you guys. This is actually my first time doing it solo. Usually our program manager, Maureen O'Connor, is in charge. So hopefully she'll see this and see that I did a good job. Um, so just a few things to start off. Cardiac arrest is the number one cause of death in the United States. It's more than the top 10 cancers combined, more than AIDS, more than car crashes, more than shootings combined, cardiac arrest. So it is paramount to recognize cardiac arrest and be able to do what you can to keep people alive. So as far as cardiac arrest, there's a difference between a heart attack and cardiac arrest. It's two different things, actually. Does anyone know what the difference between a cardiac arrest and a heart attack is? It's not the same thing. So, no cheating, no cheating. All right, so basically a cardiac arrest is an electrical issue and a heart attack is a plumbing issue. So you can recognize a heart attack before someone drops dead from cardiac arrest. A heart attack, people can show signs and symptoms. They can, that can show as chest pain, arm pain, shooting down the arm, jaw pain, back pain, shortness of breath. People can just really feel like something's wrong, like their chest is heavy, something's like an elephant sitting on their chest or a stabbing pain in their chest. It can present very severe where someone like this person doesn't look right. They look pale, sweaty, like something's wrong with them, or someone could just kind of feel I just feel something's, I don't know, I feel like I have like heartburn. Like it can present a lot of different ways. But that can eventually lead to cardiac arrest if it's not addressed. So first and foremost, heart attacks need to be able to be recognized. So you can address that, see your cardiologist, go to the hospital, because they can do all kinds of lab work to determine if you're having a heart attack or you had a heart attack, so they can recognize that and address it before it leads to an eventual cardiac arrest. So as far as cardiac arrest, that's the electrical issue. So the heart can go into something called fibrillation, which is why we have our defibrillation. Essentially, for whatever reason, the heart gets knocked out of its good rhythm where it's beating, and it's just kind of quivering inside the chest. It's not effectively pumping blood, oxygenated blood through your body. So we need to be able to recognize that. And cardiac arrest is essentially what we call sudden death. Someone just drops dead, their heart's not beating. So we need to be able to recognize that. As far as recognizing it, there's a way method we call it. It's called no go. So if I could have a volunteer, actually, that'd be swell. If I don't have a volunteer, you're gonna get voluntold. All right. So as far as recognizing cardiac arrest, you see someone collapse or someone's on the ground. We're looking for no go. If everyone could say that. No go. All right. No go. So you're looking for no response. You walk up to them, you go, "Hey, buddy, you all right? You okay?" No response. You try to shake them awake. There's nothing. They're not responsive at all. What else are you looking for? What's the second no? What do you think? No breathing, exactly. So no response, no breathing, go. Go call 911, go get the AED, since you guys have one. That's great. Oh, look at that. We got an AED right here. So before we would apply the AED, we need to be able to know effective hands-only CPR. We don't do that mouth-to-mouth stuff. People have cooties. That's gross. But also, it's just effectively doing CPR, especially if you're not someone that's trained as an ALS provider, like on the 911 ambulance or a nurse or whatever it is. If you're not really certified in CPR, effective ventilation is more of a two-man job than a one-man job, and that's more if you're really certified and trained to do it. And we're more worried about doing CPR. You're beating their heart for them. You want the heart to keep beating. Every second that you're off that chest is a second their heart's not beating. Every minute that ticks by in a cardiac arrest is a 10% time off their life. So if you call 911 and they're, city's busy, 9-10 minutes out, what's the chance of survival on that person if no CPR is done? Zip, exactly. Yeah, pretty minimal. So it's paramount that you get hands-on with CPR right away and that you stay doing CPR, switch out with people if you can, but it's vital because it literally is beating their heart for them, keeping them alive. Let's see. Let's have you go ahead and take a knee down here. I'll take a knee down next to you, if you guys can see. So as far as CPR, it's pretty straightforward. Luckily we have our hand here that is just magically, by the blessing of God, exactly the size of your sternum or your breastbone, right in the middle of the chest, or in line with the nipple line or in line with the armpits. That's how you can recognize where your hands need to go. So for you, right in the middle there, you want to take your hand, wrap your fingers like this, so you're just like a supportive hand. We can go over this as well. I can show everybody, individually as we go here, but it's just pushing down hard and fast. Yep. Staying alive. Exactly. So to the beats per minute we go. Keep going. To the beats per minute we go. There's a million pop songs that have the 120 beats per minute, but the one that we all know and is perfect for this is "Staying Alive" by the Bee Gees. Ha 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 ha, staying alive. I literally sing that in my head in CPRs when I go and 911 calls. I still do that in my head. Yeah. You don't have to be a falsetto like me. It's fine. So, as well as that beat per minute, you also want to have an appropriate depth because you really have to be pushing hard enough to be squeezing their heart, beating their heart. You can't just be kind of softly pushing on their chest because it's not really going to do anything. So the way we do it, to make it more simple, the medical field, it's like 2 to 2.4 inches, but that's a pretty exact approximation to do during a pretty hectic moment like that. So we say to do 1/3 of the chest. That's pretty easy to approximate what 1/3 of the chest is. So it's pushing down fairly hard, and on these dummies there's some feedback, but on people, this is kind of a gross thing, but it's something that's reality. When you push down on that chest the first few times, all the cartilage that's connecting those ribs to that breastbone, to that sternum, is going to kind of crunch. It's going to kind of crack, kind of like cracking your knuckles, and that's a good indication that you're actually giving effective CPR because those first few compressions are going to kind of crunch. But you're not breaking the ribs. You're not doing that. It's just kind of that cartilage is just kind of moving around. But that is a good indication that you're going hard enough for the CPR. No, not yet. So let's say someone takes over for you and, oh my gosh, they brought the AED, so we can go up to the table. Sorry. Nah, yeah. If you come up here, you're going to work. CPR is hard work. I will sweat through a shirt doing CPR. So you guys got the AED here. This is the same one that you guys have over in the other room over there. Let me just get this plugged in. You won't have to do this. You should already have the battery in it. This is just a trainer. So it's very straightforward.
Unplug training pads and plug in defibrillation pads. Press the flashing blue button to choose training scenario.
It tells you exactly what to do. It's very simple. Yep. There's little pictures and everything. Yep, training pads.
If this is an emergency, unplug training pads and plug in defibrillation pads. Press the flashing blue button to choose training scenario. Scenario 1.
So if we have these pads here, they've got little pictures on them. I don't know if, here, show the camera. Yep. There you go. So they've got little diagrams on them to show you exactly where to put these pads. They've got the upper quadrant here on the chest, and then down here on the side. So if you can go ahead and put these on, our little dummy right here. You
want to come around over to this side, Paul? Get yourself rigged up. Just down here.
Press pads firmly to patient's bare skin. Stay clear of patient. Analyzing heart rhythm.
So that's just straight out of TV and movies that you've probably seen. Clear. That actually is vital that we do that so you don't get shocked. It'll tell you if it's in a rhythm that's shockable.
Orange button now.
Clear,
Delivered.
and it'll shock. And generally with these dummies, or not, not dummies, the real people, there is going to be a shock going through them. They'll probably quiver, twitch, something like that. There's going to be some kind of jolt. So after we deliver that CPR or deliver that shock, we need to continue CPR right away. So you don't want to be stopping CPR for 5 minutes to try to figure this out. You want to be continuing CPR throughout this whole process, putting these on. It'll tell you when to stop to analyze the rhythm, shock. You go right back to CPR. CPR is the most important thing. Yes, yeah, you leave the pads on because it'll give you the metronome right here to keep doing your CPR. These pads, these ones are our practice ones that kind of fall off. Okay. So the automatic ones, these are going to tell you to stop and to do 2 breaths. Do not do that. Just keep doing CPR. We're not doing the rescue breathing. It's just you're stopping doing effective compressions to do that. Don't do that. Continue to do just CPR, hands only. Yep.
Okay, so I need if I have a backup person around, I want to have a backup person with me to take over.
It's ideal to have people around that are willing to help you to do CPR, especially if they're trained, especially. But sometimes, say you don't have the AED available. This happens at home to your significant other, or somewhere where there's not other people to help you. You need to be able to, and the adrenaline will kick in. I tell you that adrenaline will kick in where you can do CPR a lot longer than you think you can. You'll get fatigued, but when a loved one's life is at stake and you're beating your loved one's heart, you can go a lot longer than you think. Again, don't get caught up if it's telling you to do rescue breathing. We're not doing that. CPR the whole time until it tells you that another shock is advised. Another key point, bearing the chest is vital. I should have said that earlier. Bearing the chest, meaning taking clothes off. The AED in that kit should have a pair of scissors, or if not, whatever you can get to take the shirt off or to cut the shirt off. Don't be worrying about modesty at this point, whether it's a woman or not. You need to completely expose the chest to, one, give effective compressions so you can actually get the anatomical location of the center of that chest, the breastbone, to give good compressions, but also to put these pads on. You can't put the pads on over clothes. It needs to be direct on skin. You don't want clothes falling down in the way. You need to completely bare that chest. That's a vital component. So, worrying about modesty, we want to think about that, or you don't want to be. So this is the only time you would stop. It's going to tell you to analyze. It's trying to figure out if the heart's in a rhythm it can shock. No shock advised this time, so we'd go right back to CPR. Jewelry shouldn't be an issue. If there's big, huge necklaces that are hanging out of the way, like down to the chest, if you got like 50 gold chains, whatever it is, a big clock, you can just kind of like move those out of the way, kind of drape them off to the side. Definitely don't pocket them. So the AED is super basic. It's going to tell you exactly what to do, except the rescue breathing. Don't listen to it on that. Keep just doing continuous hands-only CPR. But it has the diagrams on where to put it, and it's going to tell you if it's a shock or not. You don't have to be interpreting rhythms or any kind of fancy doctor, paramedic stuff or anything like that. As far as the CPR, I'll switch you out because you already put in the work. Or if you have another, yes.
So, back in the day. So back in the day, many years ago, I was told to tilt the head to the side or something to make sure there's no obstruction in the mouth of a person throwing up or anything along that line as part of the whole process. Is that something that we still do?
So our main focus is those compressions, but if you notice that stuff is bubbling up or there's vomit in the mouth, it's just a simple turn them to the side and then get right back on the compressions. You're not going to be digging your fingers down into someone's mouth, because what do people do if someone's getting electrocuted or if someone's dying? They might clench their jaw and they're not going to give you your fingers back. So don't stick your fingers in anyone's mouth. Don't do blind finger sweeps, is what we call it. If there's stuff bubbling up, which can happen from you just pushing on that chest, you just turn them on the side, let whatever you can come out, and then get right back on the compressions.
I think when Marine, it's broken, Jeff. There we go. So Maureen came down to the Lions Club. You may have come downtown San Diego to the Lions Club. And so as part of learning this, in terms of turning somebody over, you grab them from the far side, bring them up against your knees or something like that, right? Just in case if you do notice any sort of an obstruction coming out of the mouth.
If you
Because it's
notice-
easier than trying to push them.
I mean, you
over.
want to roll them over as effectively as you can, but keep in mind if you're rolling someone towards you with a bunch of vomit in their mouth, where's the vomit going to go?
It's going to go over you, but you're saving somebody's life.
Yes.
So
It's just something to keep in mind. If you're able to, if you have like another person with you where you can roll them to the other side, that's an option. But yes, it is easier to pull someone towards you than to push someone away from you. So that is a very good point. Being able to roll someone over to get an obstruction out. If say they choked on like a big chunk of steak and you see it coming up out of their mouth, you can pull that out. But don't go digging into someone's mouth because they can bite your fingers. If I could get another volunteer, just as far as to do actual good compressions with me, I'll volunteer you. Let's see. Yeah, that's what I want to do right now. My man, there we go. So say we come up on these people, or this person, and you just you saw them collapsed on the ground. So what's our process here? No, go, right? No, go. So no response? No breathing? So what do you want to...
Go. Now, do I want to take their clothes?
Absolutely.
No, you want to tell somebody to call 911.
Call 911.
Call 911 and go what? Go call 911 and go get the AED if it's available. Absolutely. All right. So that hand outstretched, fingers interlaced. You want to be putting your shoulders over your hands so you have good body mechanics. You don't want to be pushing with your arms because you're going to wear yourself out real easy and you're not really going to be giving effective compressions that way. You really want to be driving with your whole body, with your shoulders over your hands. You want to increase your speed for sure. You want to be at that staying alive. Ha, 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 staying alive. So yeah, a little faster. Ha, ha. There you go. Yep. There you go. Ha, 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 ha. Little harder. There you go. Perfect. There you go. So, and you got to keep that up.
And I got to remember to breathe myself.
Yes, that's a very good point.
Actually, yes. Because I noticed I was holding my breath there.
That's a very good point. I was doing some training this past week he was making a point of you have to remember to breathe as well. That's a very good point that you have to remember to breathe as well. I was just doing a training this week for new EMTs that are working in the city. We had one gal who was doing her compressions great, but by the time she was done, she was beet red and like, because she was holding her breath basically the whole time she was doing it. So these have little indicator lights on the shoulders here that'll tell us if we're giving good compressions. So you should see that light up if you're at the right depth and the right rate. It should turn green. There you go. So good. Yeah, it's you're going fast and hard. You're not worried about if you're going to hurt them because how are you going to hurt them? They're what? They're dead. Exactly. So don't be worried about hurting them. You might feel crunches. Don't be worried about exposing them, or if it's somebody that, I don't want to hurt them or expose them. What if they sue me if I bring them back to life? You guys have a law that protects you. It's called the Good Samaritan Law. So the Good Samaritan Law was put in place so people aren't scared to act people, you good? So people aren't scared to act, and people do get in there and do CPR and do expose the chest so they can give effective compressions and effective AED deployment. So the Good Samaritan law will protect you in that case. It's basically blanket coverage to protect you with the duty to act. Yeah.
Quick question, if you're doing it on a young person, not an adult, any changes or differences on how you're going to approach this, and are you going to cover that? In case not, I wanted to ask, since I've got grandchildren at home.
I'll absolutely cover that. So the difference between adults and children is essentially not that different. Your rate is the same. It's always 100 to 120 beats a minute. Staying alive is across the board for no matter what size person you're doing it on. Your depth, that's why we say 1/3, because 1/3 could be different for different people. Say it's, a huge linebacker who's like twice as big as I am. You probably need to push even harder to go 1/3 for that guy, and for a child, you might have to go a little lighter. It really is playing it by ear and pushing as hard as you can determine that 1/3 of the depth of the chest.
I was asking because in an earlier class many years ago, and things are developed, right, they said something about using 2 fingers across or something versus the full on, and I just want to know, do you still use the same?
So there's one-handed methods that people do. There's with infants, there's like a encircling thumb method that we do, but realistically, we want you to be doing the two-hand and just be just adjusting your strength level basically based on the size of the person. Because there's certain training for like medical people that do those different methods for different size people for kids. But essentially, you can do the same compressions across the board as long as you're just monitoring your strength level of that. With infants, I don't have an infant dummy with me, but obviously, if it's a very, very small infant, your hand could be the whole size of an infant's chest, so you could use your fingers with that. We do a method where it's encircling behind them and pushing with your thumbs in the middle. I hope to God you guys don't have to do that, because that is rough. But that is an option as well. But as far as like a kid, like you can still use your standard method of 2 hands and just be adjusting your strength level basically. Let's see.
And just to let you guys know that our AED is not compatible with children. So while we don't typically have children in the shop, if there was a child that went down outside in the parking lot and they know we have an AED, ours does not adjust the shock level for children. So.
Yep. I mean, that's kind of like some wiggle room. Generally, in the medical field, we say like 15 and up is like a medical adult. So basically, someone that's around an adult size, they could still be a minor. But if someone's around a general adult size, we consider that an adult. And if someone looks like they're a child, that's considered a child. I mean, it's basically just you make that judgment call. Oh.
Okay, so you're the one that is going to get the AED. Is there any tricks to finding one or things to look for?
There should be posted signage for you guys on the outside window. I saw that you guys do have the AED inside sticker, and then generally, like where you guys have it, a lot of times in like the med cabinets or whatever it is, that's where an AED should be posted. But there should be bright signage that says AED here with a sign or sticker. Yeah.
There is also an app, I believe.
Yes.
That lists all the AEDs.
Yes, it's
And
called.
ours is listed with the fire department also. So a lot of the AEDs around the county are listed with the fire department. So even though we may not know that something's going on at the paint store, the fire department would know that our AED is listed on their app.
Yes, we do have an app. It's called Pulse Point. There's a standard Pulse Point which basically tells you about all kinds of 911 calls going on around, but also especially with CPR activations. So if you really want to feel like you're Ricky Rescue and you have the AED, or if you have the Pulse Point app, you can actually go and respond to a CPR, let's say right next door to you or something like that. But the AED pulse point literally shows every single location of registered AEDs across the city, and that's part of my job actually is to go check on them, and there's a lot. So that's fun.
Yeah, for home use, what is the price range for these things, and how long does the battery last? When do you have to change it?
So the battery generally has around a 5 year life. The price range can vary depending on the model that you buy. Our vendor, AED Brands, has a price list I can get you if you'd like. But generally, with Project Heartbeat, we run a deal where we can get you like a discount on the AEDs. Yep. Same thing with the materials like the pads and the batteries. They do have like a shelf life, so those can get replaced as well through this same vendor. Sorry.
Here,
Am I on?
Yes, sir.
What are the maintenance and upkeep requirements?
So through Project Heartbeat, we have like a management portal that we give like every people we set up with the AED. We do like a liaison training, a virtual training to basically go through how that website works, and essentially it has all the listed expiration dates and then the specific part it is, so that you can keep up on the times. And we also send emails out to like remind of like because we can keep an eye on it as well of when those expiration dates are due.
So do you do like an annual inspection, or are there, third-party vendors that can, come by? Is
It's
it
actually
once a year or every 3 years?
It's a self-inspection. So every 90 days, you guys do a self-inspection basically to check the AED, see that it's working, that you can turn it on, that it can run through the program. And then as far as just like the parts themselves, like the pads and the battery, those have a shelf life that we just keep an eye on, and then we update you, or you guys can update it in the management portal for Project Heartbeat. But yeah.
One other thing. Are there any plans to sort of update or delete the business about providing breaths? I mean, that would seem like a simple.
I mean that's a manufacturer like standard because there's all kinds of different standards in the country for like based on the American Heart Association, the Red Cross. Some say to just stop and do those rescue breaths, but so it's just a standardized manufacturer thing. But as far as what we teach and what we found is that hands only CPR is most effective for life. So we don't like to teach to stop to do breaths because one, if you're not really trained to do it, you're not really going to give effective ventilation or effective breathing for people. And it's more effective to just be doing CPR by itself. Also, I mean, to get medically nitty gritty, doing CPR actually does move air in and out effectively enough. There is still oxygen in the system that you're circulating by just doing CPR. So realistically, effective ventilation is when we come on scene with the ambulance. We have intubation, we have oxygen, we have all the things to really make a difference. Giving those rescue breaths and stopping CPR, we found isn't as effective for the public than just straight hands-only CPR.
And one last thing. I mean, should we put any kind of sign on the AED, not for children, or are we not allowed to tinker with it?
We'd prefer if you didn't post like your own signage. The pads themselves say that they're adult pads, so I hope that would indicate that they're for adults. Generally, also just like the sizing of them. There are pediatric specific pads that if you plug in will then change it into a pediatric mode, but for you guys that you just have the adult pads.
So, I am a bee allergy person, so I carry
Same.
around EpiPens
Yeah.
with me, and sometimes I might not be in a location where an AED is available.
Yes.
Is it reasonable to use an EpiPen at any point as part of the CPR process?
No. The dosage on an EpiPen is not a like cardiac arrest dosage of epinephrine. It's a completely different dosage, and it's a completely different route that we would give it in the medical field. We would give that via an IV, and it's a significantly different dosage than the intramuscular little poke from the EpiPen. So I like where your head's at with the adrenaline, because it is something we do, but not so with that route and that dose of an intramuscular needle. 10 EpiPens to the jugular. No, don't do that. No. I like where your head's at, but no. So the most effective thing, bar none, is just effective CPR. It makes a huge difference. The difference, calling 911, getting an AED deployed, and effective CPR will literally make the difference of life and death. The difference that we see from people that didn't feel comfortable doing CPR and we show up 7 minutes, 8 minutes later, that person, odds are, just statistically, is not going to have as good an outcome. If someone recognized it, did CPR right away, if they were in public or there's an AED, that person will be awake and going, ow, my chest, before we even leave to the hospital. It's a night and day difference. Yes.
Just a real quick question. You got me thinking about this a lot more. So thank you. Somebody asked about purchasing or something. So are these available for, if you've got the disposable income and everything else to have in your home? Would it be something that people would recommend, medical people would recommend, yeah, have it in your home if you can afford it?
They are available for purchase. They're not like a restricted item by any means. They are pretty pricey, so that's why with Project Heartbeat, it's we offer the discounts for like nonprofits and stuff like that. But there's yeah. So I mean, well, as far as like an organization or a business, yeah. They are available for purchase. There's no like restrictions on buying them, but yeah, they are.
You can buy one on Amazon.
Yeah, but they are a little pricey by themselves. Any other questions? And then no, not as pricey as the medical bills.
One quick question should any consideration be made if you sense that there might be a pacemaker?
A pacemaker, if there's a rhythm that is not shockable, there's only 2 rhythms that the AED is going to recognize if it's shockable or not, and that's that it'll read that. So if the pacemaker is giving off something, but if there's no pulse or the person's not breathing, we still want you to do the CPR regardless. There's other medical devices that will be very obvious, but they're super rare, so I won't get into that. But pacemaker shouldn't be an issue at all. CPR is absolutely viable with pacemakers, and the AED will tell you if it wants you to shock or not with the pacemaker.
This no, and go, is that the thing that's going to differentiate between the plumbing problem and the electrical problem, or what's the AED going to figure out about that?
So that won't differentiate those two. Essentially, what I was saying with the plumbing versus electrical, heart attack is basically a blockage of an artery, a vessel, something's getting occluded where that heart muscle isn't getting oxygen, and eventually it starts dying, and that can lead to the electrical cardiac arrest because that heart muscle starts just ineffectively working, and that can lead to the cardiac arrest. But cardiac arrest could happen by itself, or a rhythm just happens that people drop dead. So that that doesn't make a difference by itself. And realistically, whether it's a heart attack or sudden cardiac arrest, if that heart's in a rhythm that's shockable, the AED will shock it. But sometimes, it's not always in a shockable rhythm, so that's why we want to do the CPR across the board. The AED is a amazing resource that literally will bring people back to life, but people that are in cardiac arrest aren't always a shockable rhythm. They're not always in that rhythm that the shock will fix. So that's why the CPR is important across the board, because then when the ambulance gets there or the fire department gets there, they can give medications that can kind of kickstart the heart maybe into a shockable rhythm or make a difference, so we can transport them to the hospital and they can do more. But the AED can only do so much, so that's why the CPR is the most important part.
So generally, if somebody is having a heart attack, there are symptoms associated with that.
Yes.
Rather than a sudden cardiac arrest.
Yes.
So normally, if someone looks extremely pale, they're complaining about chest pains, et cetera, the first thing to do is call 911.
100%.
Any
Yes.
circumstance.
That's our first thing to do, no matter what, in a shock, is to call 911. That, above all, that's what you need to do. Your CPR isn't going to sustain life for 30 minutes. You need to get that 911 call done. Okay, so no matter what, if it's one person or 10 people here, someone needs to be calling 911 while someone's attending to the other person.
That's why it's no go before you start. It's go call 911, and that could be if you're by yourself. That means you call 911 before you start any CPR. Because us getting there to help and do all the things we can do is critically important. Yeah, but it makes a huge difference if you do something before the time we get there. That makes a drastic difference because again, every minute that ticks away is 10% of your life.
So is there a signal that we would know to stop CPR? I mean, what if the AED wakes them up?
There's a pretty good indicator. It's when they go, oh, ow. No, but also like facial movements. They'll start breathing on their own. Possibly they could start blinking. Stuff that's obvious signs of life would be an indicator for you to stop. Otherwise, it's recommended you keep going. If you're not sure, just keep doing CPR. But if there's obvious signs of life where they start like looking around, then you could stop. But then keep an eye out because oftentimes when people come back, it's very often that they might go back into cardiac arrest. So don't just go, okay, I'm done, bye. And especially if the ambulance isn't there yet. Continue to stay and monitor them and in case they go back into cardiac arrest. Like, it can, absolutely.
Hey guys, when you got a question, wait for the mic, please, so everybody else can hear.
So I took a CPR AED training about a decade ago, and one of the recommendations was if the person has a very hairy chest, there should be sticky pads in the kit, and you need to give them like emergency.
Emergency waxing, no, but not necessarily, because you don't want to get these covered in hair because they're not going to really be as effective. But there should be in that kit, along with like scissors to bare the chest, there should be basically a razor. So not to have a razor. Okay.
We have scrapers and sandpaper.
Okay. Hand plane works.
Interesting that they recommend not to have the razor. So that's a good point. If someone's got like a shag carpet on their chest, what we would do and what some other kits have are a razor to shave just those points just to get it down a little bit. Other things to keep in mind also are if someone's really wet, whether they were in a pool, so you're not here. Say they were in a pool or they're super sweaty, they just finished a marathon, whatever it is. Drying them off before applying electrical equipment and they're not in a pool of water that you're sitting in is a very good thing to keep in mind so you don't get electrocuted as well. And that a shock is delivered effectively on them, that they're not soaking wet or literally in a pool of water. There's some other...
I don't want to make this lengthy, but the most important part of doing this is be the person right from the second it happens that you go and deal with it. Don't wait 5 to 10 minutes and say, gee, I don't think she's going to get up. Maybe I should get involved. It's really important. I've seen that people floating in the bottom of the pools, whatever story you come up with. And it does, this machine, if it's done quickly, it does work very effectively.
Absolutely.
And it's, use the darn thing. So,
absolutely.
Okay.
Effective CPR and AED deployment literally makes you a lifesaver like that. It's a amazing piece of technology, the AED especially. CPR is fantastic for keeping their heart beating, for us to get on scene and to be able to do what we need to do to get somebody back to life or get somebody to the hospital. But you can make all the difference in saving someone's life with effective CPR and an AED properly used. It literally can bring someone back from the dead. It's amazing. So it empowers you to do that. And take the initiative to do that, to recognize it, and to use it.
Just one other quick thing. They said about the breaking of the bone of the sternum. First time you do that, that's a sound you'll remember the rest of your life.
Oh yeah, no, not traumatizing at all. But there's all kinds of things with CPR that are gross, disturbing, like weird things, like burying the chest on a woman, for instance, could be something where you're kind of like hesitant to do that in like a public space. But this is this is literally a life and death situation. So decorum goes out the window. You know, being worried about the gross stuff should go out the window. It's really like it's one of those instances that this is the number one priority. So yeah, that crunching of the chest, that's disturbing, but it's a good indicator that you're really giving effective compressions because you're going deep enough and hard enough to be beating someone's heart in their chest. So it's disturbing, but it's reality because, you know, someone dropping dead is a disturbing thing.
And speaking of compressions, like if something happens, whether here or somewhere else, pay attention to whoever's doing those compressions, because if they're in fact giving effective compressions, they're going to get tired. And that's a great time for teamwork and say, hey, I can step in. When that AED is cycling to look at a shock rhythm, it's a great time to switch out that person who's doing compressions.
Absolutely.
So this isn't, you're not alone. Whoever responds first is not the lone show here. Like you're a team. So whoever's getting the AED comes back and they're a team. Whoever's going and calling 911 can come back and be a team. So just remember you're not alone and no one needs to be.
Yeah, don't let an ego get in the way, because some people will go, no, I'm doing CPR, I got it, and they're not giving effective compressions, and you feel like, oh, I could give I'm fresh, I could give effective compressions. Don't be afraid to tap somebody on the shoulder and go, hey, I'll switch out with you, because somebody could be just going, I got it, and they're not doing anything. They're not giving effective CPR. Don't be afraid to tap somebody on ego check somebody and go, hey, I got it from here, I can take over, because it's effective. It's not just the fact that that you're doing CPR. You'd be giving effective CPR. There's a difference. Just kind of tapping someone's chest is a lot different than effectively giving effective compressions. So, any other questions? Yeah.
Hey guys, shift supervisors, SIG leaders, instructors, you're going to be here. You're going to be the person in charge on when the event like this may happen. Remember our protocols here. I want to make sure that everybody understands that. We want to have somebody call 911 right away. If you got more, you're not going to be in the shop alone. Get somebody to call 911. Get the AED and the CPR started, and send somebody out to the side to direct them where to come. Because in our building here, we get 5360 Eastgate Mall is going to come up, Suite E, but they're not going to know exactly what door to come in and where to, if we got the front and the back, you know how much confusion it is. Get somebody out there to meet the emergency responders and get them in. If it's the front of the building, back of the building, whatever it is, we're going to tell them. And have that phone with you on the speaker so that the dispatcher can be giving instructions, and keep that phone on speaker so everybody can hear it. And the person doing CPR is getting the instructions. Now, in our kit, is everybody familiar with where our kit is? Where our AED is? There's a telephone there. We have the scissors and all the equipment we need, along with a cheat sheet right in front of you in bold print of what to do. And so what our protocols are. I want to make sure particularly the SIG leaders, chef supervisors, and instructors know about that.